example, so what if somebody came to you guys with a shoulder injury? What would be some of the key differences that you would say would be how you would treat a shoulder injury versus how like a Pilates instructor would treat an injury?
Well, we would probably do a lot of the same things.
Right.
Exercise based. We probably overlap a lot for that,
Yeah.
those things. I mean, you guys are movement experts as well. We're gonna be able to offer the hands on those joint mobilizations if that's what's causing their
Yeah, we're also
issue
trained
and-
in differential diagnosis, which is
Yeah.
a really important thing because someone comes in, they have a shoulder injury. Is it just a sprain? Do you have a profound rotator cuff injury? Do you have a frozen shoulder? Is it a cervical? Is there something going on in your neck that's
Right.
causing what's
Yeah.
called radicular symptoms or pinched nerve? So I think definitely you want, because if you don't know exactly what is causing the pain, you're not going to be able to do the corrective exercises. Do
Right.
you know what I mean? We see
Right.
that a lot with back pain. Some people, there's flexion approaches and an extension approaches, and if you just go on Dr. Google and like Google back pain and you have something that needs a flexion approach, but you're cranking into an extension approach, you're gonna cause more pain, and cause more dysfunction. I think.
and longer period of healing then too.
Right.
It's gonna take longer.
So while Pilates instructors are not trained in the same way in order to and it's certainly out of our scope of practice to diagnose, I think where this unique opportunity comes for Pilates instructors to contribute to someone's rehabilitation of an injury, for example, with the shoulder, is that Pilates instructors are looking at overall movement patterns and
Yes.
overall walking, holding, bracing, gait patterns.
Yeah.
And sometimes that can be a little bit lacking, certainly not in your case, your two cases, because you're also Pilates instructors. But for example, Katie also worked as a physical therapist assistant in Minnesota? In Minnesota. And you were describing somehow how sometimes it was frustrating to only be able to work within the confines of the insurance industry and only be able to help someone. You would be able to notice this overall compensation pattern that needed to be addressed in their body, but because of the confines of like the insurance industry, you wouldn't necessarily be allowed to treat it as
Absolutely.
such. Right.
Yep. And then that's when it came to like their rehab after like the actual injury started to feel better, the pain kind of subsided a little bit, and then starting to give them exercises that became like more full body exercises.
Right.
Because then like you're able to treat them, but then that's when I use Pilates.
Yeah.
In this clinic, like I can just do like TheraBand stuff.
Yes.
Yeah. Like Pilates.
And that's
Yeah.
so important too. A huge pet peeve in the whole physical therapy realm, which it sounds like you've seen, I know Caitlin's seen, is someone comes in with a shoulder injury, you're not just a shoulder.
Right.
It's you have to look at the whole body. You have to see how, if anyone who thinks that, oh, your shoulder acts independently from everything else is just being
Right.
short-sighted. So
And conversely, also, if a physical therapist is someone who's not fully trained as a Pilates instructor, and they're like, well, what? Oh, okay, a knee. All right, we're going to do maybe a couple knee exercises that are Pilates exercises. That's kind of defeats the purpose and the philosophy of Pilates,
absolutely.
which is whole body movement, balanced movement, and
Yes.
balanced composition.
Control.
Yeah.
Right.
Absolutely.
Control the
I
shape.
think there are many exercises in Pilates that are just like single joint. In the sense like it's hard to be like, okay, find a Pilates exercise that's truly just a shoulder exercise.
Right.
Like even your sidearm series aren't just shoulder exercises.
But when do you just
Right.
use a shoulder?
Exactly, right.
You
Exactly.
have
So
to
I
have
think it's
thoracic
great. So even if you
mobility.
give like somebody a Pilates exercise,
Yeah.
they're getting a full body thing.
I
If you're teaching them correctly.
Yeah. So now you guys as physical therapists also have this gorgeous studio
Thank you.
full of red reformers.
Yes.
Not only you can see red Cadillacs back there, but it's all red and I love it. But you guys, you treat your patients here. You have some treatment rooms
Yes.
that are private, and then you also have the Pilates equipment. And is this your preferred way to get people moving once you guys have moved out of the initial stages of perhaps treating more acute pain?
Absolutely. I mean, it's like we've already talked about, you work the whole body and people enjoy it. They're having fun and it's a safe movement and it's a positive movement experience, which is
Absolutely.
so important for healing.
And it's just teaching someone to be in control of their
Mhm.
entire body.
Yeah.
You know, so many people just don't actually have a sensation or like a body awareness to be able to know where their body is in space. And I really don't think that anything will heal
Or
until
understand that, okay, this is what it feels like when I'm slouching.
Right.
Oh, this is what it feels like when I'm not slouching.
Exactly.
Oh, I've been slouching for a long time.
And I have
just-
control
right.
of that. to be
Right, and I
able
can
to
change that, and movement
Yeah.
can heal, and I can teach myself new patterns.
Yes.
Yeah.
And it's
And from that thing, the therapist, the physical therapist is maybe the one that's gonna help you like from a joint level get
Yeah.
to that point.
Right.
Right? Because if you've been slouching all day, you could do Pilates a few times and not feel like you can actually even get into
Right.
the range of motion because it's a structural thing.
Right.
So sometimes
So they're
that's
not really
where-
diametrically opposed, it's not like
Not
one
at
or the
all.
other, they really meet together
Yeah.
in a continuum of healing.
yes.
Thanks so much for taking the time to talk
Of
about this,
course.
you guys.
Thank you.
Anytime.